Good afternoon, ladies and gentlemen, invited guests. It's my pleasure this afternoon to speak to you and to demonstrate to you that your mobile phone can be used for a lot more than conversation. It's a tool that can be used for advocacy, education, and to bring about NCD awareness. This was a novel Caribbean campaign called the Get the Message campaign. Who are we? We're the Healthy Caribbean Coalition, an indigenous Caribbean NCD alliance, bringing together many different civil society organizations and spearheaded by the visionary Professor Trevor Hassel. This organization was established just in 2008 following a civil society conference on chronic diseases called the Healthy Caribbean 2008, a Wellness Revolution. It's an entirely volunteer-run organization, and we have limited funding from corporate partners. In March 2011, the HCC launched a novel NCD advocacy and education initiative, which I'm going to demonstrate to you today. This was launched in 15 Caribbean community member states and 2 associate territories. The overall aims of the campaign were to raise awareness for this United Nations high-level meeting on NCDs. Also, we wanted to develop an advocacy initiative that would involve the youth. And normally when you're talking about non-communicable diseases, usually you don't get the attention of youth. So we wanted to do something that would drive youth involvement in NCD advocacy. And we also wanted to develop a catalyst for the strengthening of the capacity of the HCC to make the coalition stronger and to develop new things that we were capable of doing. And most of all, we wanted to demonstrate that civil society can come together around a major health issue. Our objectives were to educate Caribbean people about NCDs and the high prevalence of these diseases and how they impact their lives, especially if they lead unhealthy lifestyles. We had an education goal. We wanted everyone to know that it takes the whole of society and the whole of government to combat NCDs. We wanted to have a place, a forum for fostering conversation about NCDs and healthy living, and also a forum for communicating about NCDs among the youth. Further objectives, which were the advocacy objectives, were to inspire a popular people's movement. As we know, even in this last year, mobile phones have been used for lots of people movements of varying kinds around the world. But this is a health people's movement to agitate for change and lead to a decline in the common risk factors for NCDs, namely tobacco exposure, excessive alcohol, unhealthy diets, and physical inactivity. We also wanted to create a movement that would encourage Caribbean leaders to attend the summit and actively and aggressively address these risk factors for NCDs, structuring effective health care systems. This is the Caribbean, for those who are not familiar. From Florida, you have the Bermuda and the Bahamas, stretching right down in the archipelago, right down to Trinidad, just off the tip of Venezuela. It's a region most people refer to as the islands, but each of these islands have very different cultures, sometimes different languages, different socioeconomic situations, and different rates of literacy. So they're one region, but we're very varied. So these are our challenges in coming up with this campaign. We wanted to introduce the concept of NCDs in all of these territories, bearing in mind that the audience is not going to all respond to the same things because of the variation between the islands, as I spoke about. First of all, we had to overcome the foreignness of advocacy. Ours is not a region where advocacy is a part of our culture. The government does something, people accept it, they agitate for a few days. In Barbados, we say 9 days, and then they go along. So advocacy is a foreign concept, and empowerment, people, ordinary people speaking out about what they want, was a new concept. We also had to introduce the concept of using a mobile phone technology for advocacy. This was the first we know of this kind in our region. And at the same time, we had to educate about the United Nations high-level meeting and the importance of this meeting. There were no precedents for this campaign. It was hard to set targets because we didn't know anything about such a campaign in any other region. We had to design messages, and we had to determine what strategy would reach each audience in each of our territories because of the uniqueness of the Caribbean. There are only small teams in each island of volunteers, and sometimes small teams had a large population of mobile phone users to reach. And at the Healthy Caribbean Coalition, we had to manage these small teams. And finally, funding. We had to get corporate partners willing to participate, even though they weren't going to make a lot of money out of it, or none, actually. So our partners were the two major regional mobile phone providers. They had a combined base of customers of 10 million subscribers, a traditional media network, a major regional health insurance company, and WHO PAHO in partnership. The strategy was to use SMS or text messages via mobile phones to act as an electronic signature. So once a person had responded using the mobile phone, it would be sent directly to the service provider, and that would count as their signature on a petition, as it were. The mobile phone providers sent out text blast messages to encourage participation. These text blast messages would go out to all of their subscribers and encouraging them to send a text in support of the campaign. To support this, we had to use traditional media, TV, print, radio, to also encourage people to get on board and to participate in the campaign. We created 5 educational public service announcements teaching people about diabetes, asthma, obesity, and also about lung disease. And we had an advocacy PSA just encouraging people to use their mobile phones for texting. The textathons were days that were dedicated to people sending texts, and we used the radio heavily for these to get people to participate by sending texts on a particular day. Press releases were also used, and initially we started using social media to generate a campaign buzz. But then this took a life of its own, and following me, Chris Hassel will explain how social media really came into play during the campaign. We produced a lot of other supportive posters, stickers, flyers, and T-shirts, and we attended community events. Wherever there was a large gathering of people, we tried to be there. So 160-character text blasts, these were sent from the mobile phone providers to their customers, and they were prompted to send the simplest possible form of advocacy, that is, answer yes if you are in support of the Healthy Caribbean Coalition campaign. This text was sent to a specific short code, usually a 4-digit code, created and activated by the service providers. An automatic response was generated, and most of all, these text messages were free of cost. This was vital to get all of the partners involved, because no one had to pay for a text message, meant that more people would participate. This is the Get the Message logo. It was a universal recognized symbol, the envelope for message on your phone, on your computer, on which we superimposed the M of Get the Message. It was put on all of our campaign flyers and posters and whatever we sent out. And that was our slogan, get the message, text the message, and be the message. Because we wanted people to not only understand that chronic diseases were going to shorten their lives, but we also wanted them to text and advocate for change. We wanted them to be the message, to live out the changes that were needed by adopting a healthy lifestyle, and also to be the messenger, the ones who would take the message to other people. So we tailored it for every audience, and campaign partners such as in Barbados, for example, one of our large supermarket chains, they used the computers that are near the checkout desk at the counter, and all of them ran Get the Message PSAs to encourage staff and customers to send SMS text messages. Another example is regional health journalists attending a PAHO, Caribbean Broadcasting Union conference, were encouraged to all cover NCDs and also the Get the Message campaign. Specific organizations, for example, a hospital in Antigua, would send out messages over their intercom actively encouraging their staff to text in support of the Get the Message campaign. And we had visual campaign material which were shown on multimedia screens during both regional and international events. For example, we had cricket, which is our major sport in the Caribbean, and therefore we were able to show the Get the Message PSAs at cricket, which also would then be shown again on TV and reach a wider audience. So these are some of the images from the campaign. As you can see, yours truly distributing material on the road. This is at a Labor Day walk in Barbados. We've also got some students here texting together, a group of young people on the beach sending texts, some young men hanging out sending texts. And these are the images of many events that occurred during the campaign. I want to mention especially Haiti, because we had to translate all of the campaign into Haitian Creole and educate people in an environment of low literacy. We did this, one of the ways was to use a truck with a loudspeaker. The loudspeaker was emblazoned with the logo Dit tout monde, which means for everyone in Haitian Creole, because Get the Message didn't quite translate. So what are the results? Well, the million text target, the million text target, as you heard from Dr. Hospitalis, was not a scientifically based figure. It was something that just came because it sounded like we'd want to get 1 million texts from the Caribbean. But we had no idea how many people we would get to be able to text. We had no idea what the capacity of the countries were, and this was the first time that something like this has happened. As you see, our final figure was 460,091, and that represented about 46% of what that million that really came out of nowhere. So I think that we did pretty well, and all territories, most territories had some response, generated response. I just want to point out in particular Antigua, where we projected to get the country target of 35,000. This should be where we projected to get 10,000, sorry, I'm looking at the wrong line. We projected to get 10,000 and actually got 33,335. So some countries produced more than we expected and others produced less. What were the factors that determined what a country produced? Well, the size of the campaign team relative to the size of the target audience. So if you had a country that had a very small campaign team, just 4 people working together and a large population of over 1 million, you were not likely to get as much response. The strength and the motivation of the local campaign team was also vital. The amount of support that we got from other media and the number of text blasts sent out in each territory. While the mobile phone providers are the same for the whole region, each region had its own office, as it were, and that determined how many text blasts were sent out in that particular territory. We learned a lot of lessons along the way. You have to have a realistic time frame for achieving the objectives. It's important up front to identify the key decision makers among your partners at an early stage and set the clear roles for these partners. Do not step outside of your area of expertise. We learned this the long way. If mobile phone providers are better at creating text blast messages, then let them do it. Also critical is achieving buy-in from regional NCD alliance partners not accustomed to working together. We normally have cancer over here, diabetes over there, and heart disease over here. And for the first time, we're asking everyone to come together, work together on one campaign. We also learned that you need to develop strong, motivated in-country teams of volunteers, that having free text was critical to the success of the campaign. Data must be reported from the mobile providers in a timely manner. Ideally, reporting should be controlled by the campaign and not the service providers, because then you have to wait on them to give you figures as to how a country is responding, and that may determine your allocation of resources. The biggest lesson learned is that mobile phones can be used as an effective tool for advocacy and education with respect to NCDs. Beyond this conference, we want to establish the Get the Message group as a specialized advocacy division of the Healthy Caribbean Coalition. We hope to purchase a mobile network system with a unique 4-digit short code that we would hope would be used continuously, and that other NGOs, other NCD groups within the Caribbean would have an opportunity to use this for advocacy, education, and also to raise charitable support for their organizations. We want to develop a powerful lobby that will influence Caribbean politicians and political structures, because when they see that this is something that people are saying over and over again, they should respond, we hope. I show you now some of the images of the posters from the campaign, and I leave you with one of the radio ads that played continuously throughout the region.
Get the message, text the message,
Thank you.
read the message. Hi, I am Andy Blood Armstrong from Barbados, and I am appealing to you to text yes to 4357 on your line phone or to 4325 on your digicell phone, and your support will count as a vote for increased attention paid to the prevention of chronic diseases such as cancer, diabetes, high blood pressure, asthma, and heart disease. The text is free, so get the message, text the message, read the message. Get the message, text the message, read the message.
Thank you.
Thank you very much, Linda.